Hello, everybody. Dr. Vuong here, the sports surgeon. I wanted to shoot you this little video about why, um, in my clinic, we refer to weight loss surgery as their new babies. And again, this is Sunday morning. I like to shoot these videos on Sunday morning without any sort of makeup or hairdo because we really try to impress upon my patients that you're beautiful at any time, wherever you are along your journey. So in my clinic, we often refer to our patients' new weight loss surgery as their new baby. And there are several reasons why I do this. First of all, I hate the term that the weight loss surgery is a tool. That already has negative connotations. We tools eventually break down. So instead, I like to say that the weight loss surgery is your new baby. It doesn't matter which weight loss surgery you have. It applies to bands or bypass or sleeves or any new thing that they might come out with. For me, it's going to be mostly a sleeve because I'm a big fan of the gastric sleeve right now. So when I discharge patients from the hospital, during their discharge instructions, I tell them that they need to always be really mindful of their new baby, and it's their baby. It's their baby, and do you remember when you first brought home your new baby? All you wanted to do was spend time with the baby and look at the baby. You never put the baby down and forgot about the baby. You were always wondering, why the baby was crying, what the problem was. You always gave so much attention to the baby. In the same manner, they needed to do the same thing with their new weight loss surgery. If the baby starts acting up or crying, you always kind of say, "What happened, baby? What did I do? What do you need?" And if you've ever seen a new mother with her new baby, or a new father with his new baby, and they're caressing that baby, they handle the baby with such love and tenderness. There's unlimited concern. There's nothing that that parent would not do for that new baby. And in the same manner, I want my patients to treat their new surgeries like that also. The way we treat our new babies when we first bring them home will determine how they grow up. So people often think that their teenagers started misbehaving once they turned 13 or 14, and that's not really true. It wasn't a product of the years passing by. If your teenager is acting up and misbehaving, it's because of the seeds that were planted when they were just little babies. And in the same way, if you want your weight loss surgery to be great 10, 13, 15 years later, it's all the things that you are doing right now when your sleeve is fresh, when your weight loss surgery is young, that's going to make the difference. And so, so as your baby gets older, you also have to become a better parent. Like, you cannot give your 5-year-old or 6-year-old the same toys or the same books to read as when they were 1 or 2 years old, and you can't do the same activities when they're 10, 11, 12 that you did with them when they were one or two. If you're playing blocks with your 10-year-old, you're in trouble. You should be teaching them how to play chess and exploring nature and stuff like that. So in the same way, when your weight loss surgery is young, you give it baby food or the little stages of food. But as it gets older, you can't keep giving it baby food. You can't give it junk food. You can't keep giving it French fries and chips and wondering why the baby's not developing properly. You've got to give it better food, more nutritious food, healthier things. And in the same way, of an activity, you can't continue to just walk. Um, as the baby gets older, you've got to start jogging with it. You've got to start um, doing different activities with it. You got to start challenging it more. You've got to test it. You've got to learn how to garden. You've got to learn how to meditate. You've got to learn how to read better books. You've got to journal. You've got to do all these higher level activities. You can't just keep walking and watching the same TV shows and watching and reading the same People magazine, and then you wonder why um, your weight loss surgery is struggling now that it's a teenager or a 5 year old or whatever have you. So, um, what you do with your newborn baby sets the stage for um, what that baby will be like when it's older. And um, it's during this first year period with your weight loss surgery that I believe is really most critical in terms of your long-term success. I just want you to remember to treat your new weight loss surgery like it's a baby, and you will hold it and caress it with love and tenderness always. And as it grows, you too must grow with it and challenge it and believe in it and never disparage it and only lift it up. All right, I hope you have a wonderful day. If you like the video, please share it. Bye-bye.